All right, well, welcome everyone, and thank you for joining us for the third and final session as we launch Wave 2 of the Store It Safe Quality Improvement Project. I am recording today's session, so you will be able to share that with your colleagues. We should have a few more folks joining us today, so I know getting on exactly at 12 can be a challenge, but everyone will at least have the recording if they're joining us late. So as a reminder, there are no relevant financial relationships to disclose for today's presenters. We always want to thank the Ohio Department of Health, who are the very generous funders for the project. And we appreciate all their support for Wave 1 and Wave 2 of Store It Safe, and are just really delighted that we get to continue doing this work with them. As a reminder, to save time, we ask that you please enter your name and your practice name in the chat. That helps me keep attendance. So if you would go ahead and do that, if you're on the call, just again, your name and your practice's name in the chat, and I'll send a chat reminder to do that as well. I wanted to mention, since we did launch entering data on December 1st, the practices that are in green are practices that I have been seeing data come in from. So if your name is not highlighted in green and you have started entering data, please check with me, because something may be not kind of technologically working correctly. So let me know that. But I've just took a peek, and these are the folks who I have seen some data from. Now, we do have a new clinic joining us, which is Cleveland Clinic Lakewood. I would not have expected to see data from you yet, so no worries about that. All right, again, just a reminder, enter your name and your clinic name in the chat box for your attendance. A quick data reminder, since we have started, you should be entering data as of December 1st for all of your sports physical and well-visit appointments for age 12 to 21. I know some of you do the screenings and the process for age 11, and it's totally fine if you want to keep the same process and enter that data. We'll just separate that out when we report your data, so that you don't have to have two different processes. But I just wanted to mention that. On December 20th, we're going to take just a preliminary data pool just to see kind of what we have, how everybody's doing, so that we don't have to go so far into January before we get some kind of check. So I'll pull that data down, we'll run your charts, and I'll share those with you via email, just so you can get a look at how things are going. So keep in mind that that means I'll be emailing you probably around the 20th, 21st, just to get that total number of appointments so that we have that to use for a denominator. So I'll send that in a reminder email, but I just wanted to give you a heads up about that, to just do the best you can to give us that denominator number for your 12 to 21 sports, physical, and well visits appointments for December 1st through the 20th. Also to mention, so next week and then the following Tuesday for a couple of days, I'm going to have what I'm calling SIS office hours. These are going to be an hour during the lunch hour that you can pop in and ask me questions, get help with your workflows, kind of anything that's going on. I will be sending you a Teams meeting calendar invite for those. So those will be on your calendar. If you won't have to be on for the full hour, you can pick and choose. But it's just a time for us to kind of check in. So the dates are going to be the 12th from 12 to 1, the 14th from 12 to 1, and the 19th from 12 to 1. And again, I'll send you all calendar invites for those dates. Wanted to just review with you quickly kind of our objectives for today. So one is to identify and be able to use reach skills. Learn and implement skills to have lethal means restriction discussion during well visits, and apply the knowledge that you gained today with patients and families regarding safe storage options and the importance of barrier methods. And with that, I'm going to pass it over to Dr. Denny.
Great. Thank you, guys. And thank you all for joining. I know if your morning was anything like mine, getting on for a 12 o'clock call is challenging. Also, welcome to the new practice. As you're reviewing the recordings, if there's anything I can do to help, I'm happy to set up a call and we can talk through anything you have questions on. In addition to Kristen's office hours, I think that would be great. So, we've spent the first action period call, or the first learning session, we were talking about kind of the why are we doing this, and how are we going to do it with the screenings. And then you talked more in depth in the second action period call or learning session around the data collection. And what we've learned through this work with other practices in the past is the most challenging part of this project is not implementing the screening. It's feeling comfortable and getting comfortable having the lethal means restriction discussion. And so we have been, we've really focused on that this wave and last wave, and we've been really thankful and grateful to our colleagues at Cincinnati Children's who are joining us on this call and are going to be doing kind of the bulk of our discussion today. And I shouldn't even say discussion because it is definitely interactive. And I would encourage you to take a risk. This is a safe space, and get engaged and participate. We've gotten a lot of feedback after this particular session that just even practicing it on this call makes people feel much more comfortable having these lethal means discussion in clinic. So I definitely encourage you to do so today. All right. So I'm going to just briefly talk a little bit about, what exactly do we mean by lethal means discussion. This is something that we want to be doing at all of our preventative health visits from 12 years up. This is not just for our patients who have a history of mental health issues, history of suicide attempts, history of depression or anxiety. We know that teenagers with no history of any of those things think about suicide, attempt suicide, and complete suicide. So we need to be talking to all of our teenagers about this. Next slide. Okay. So, just like how we talk about gun safety or any sort of safety in the toddler visits, we're framing the same discussion in that safety as part of the safety discussion. So, the way my talk goes is I'm talking about wearing seatbelts, I'm talking about distracted driving, and then talking about if there are lethal means in the home, is it kept locked up, and being very specific. I think we talked about this in the first action period call. If someone has a gun and the teenager is really well trained in, that gun and has access to it, meaning it's being kept in a safe, but the teen has access to the safe, meaning knows where the key is or knows the combination, then you're not restricting access. So being very clear on what you mean when you're talking about restricting access to lethal means. And so, however the scripting works best for you, and we'll practice that a little bit later today on this call, is, just like we talk about safety for the little ones, the risks of injury and death change by age. And so, at this age, this is what we're talking about. Next slide. Okay, keep going. Yeah. So, instead of asking in a way of that might be come across as judgmental. So, do you have a gun in the home? Do you have, medications or drugs in the home? Asking in a different way, if you have these things in your home, are they kept locked up? Are they kept, out of the access of your teenager? And I think too, yes, absolutely, we're talking about firearms, but there's more than just firearms as lethal means. And it's probably in every home, I would guess most. So, making it not just about guns, but about any means that a teenager could access to attempt suicide. Next slide. Okay, so, again, we want to explain why we're having these discussions, just like how, when I'm talking about drowning as a risk factor in kids 1 through 4, drowning is the leading cause of death in the United States in kids 1 through 4. That's why I'm talking to you about swim lessons and drowning risk. Same thing in our teenagers. This age group has a lot of hormones going on. They can be very impulsive. They have a still developing brain. Their frontal lobe is not fully formed. I think any one of us who is parenting teens right now can attest to all of this. So, why is it that we're having this discussion? And, things that maybe don't seem to be a serious emotional situation to us can still be perceived by that teenager as something very, end of the world, really a crisis situation. And so again, as we talked about in that first visit, encouraging families to have those, regular check-ins with their teen, and then also, if there is, planning for a crisis before the crisis happens. So just making sure that we're having these discussions, and you can kind of roll the whole thing into one discussion about not only lethal means, but also crisis planning, and also having those regular. Next slide. Okay, so again, we want to be talking to all of our youth about this, not just kiddos who have a history of mental health issues. And this kind of goes back to the talk that we did at the very beginning when I was talking about the study that was done where researchers interviewed people who had attempted suicide and about the timing between their decision to attempt and their actual attempt. And we know that the majority of those are 1 hour. It happens within an hour, many actually 15 minutes, but this is where barriers are so critically important. If we can buy a little bit of time, if we can buy 15 minutes, buy an hour, we can often get the youth through that crisis time, and keep that lethal means out of their hands so that, we can go on and problem solve and work with the youth on how to work through whatever the situation is. But if they're, in that 15 minutes where they've made this decision, they have the access, that's when we can really see some fatal results. So those barriers are so critically important. Next slide. Okay. So again, just being very clear about what does restricting access mean, keeping things locked, the youth not having access to those locked guns, those locked medications. Next slide. All right, yes,
All right.
that is.
Thank you. Oh, go ahead, Dr.
I was
Dean.
just going to say that is it for me. Again, so excited to have our team from Cincinnati Children's on the call with us today, and so impressed with how they've managed to make this virtual experience very interactive. So again, just encourage you all to take a risk and participate. So I'll turn it over to the Cincinnati team. Thank you guys for joining us.
Yep, I'm going to stop sharing. Also, again, please feel free to chat in any questions or unmute yourself and ask questions. We want to keep this informal. So I'm going to stop sharing so that our Cincinnati colleagues can share their screen.
All right. Hello, everybody. My name is Joe Reel. I'm a general pediatrician over at Cincinnati Children's. Let me jump back to our slide here. Well, thank you, Dr. Denny and team, for having us again here today. Super excited to talk with you guys and hopefully practice some skills that will have applicability to when you're talking with families about lethal means in clinic. Some of our other team members are here. So Dr. March is also a pediatrician at the Pediatric Primary Care Center. I believe she has no voice today. As we all know, there's lots of things going around. So hello, Michelle. I won't have you introduce yourself though. And then Matt Zakoff is another collaborator on our team. He is one of our critical care attendings, and he is working in the ICU today. So I'm happy to present today our REACH firearm safety curriculum. So initially we targeted residents with this work. So REACH stands for Resident Education and Counseling on Household Firearm Safety. And so this curriculum was created in collaboration with Massachusetts General Hospital. They have a Center for Gun Violence Prevention and have been providing firearm safety training to providers using standardized patients. So we're going to try and sort of imitate that process today using our virtual patients. So a few notes about this conversation before we get started. So we do want to just take a moment to recognize that, discussions around lethal means, violence prevention, firearms can be deeply personal. This is a zero judgment zone. Everyone brings their own experiences to this issue. And our efforts here are not about gun control. Our only motivation is really to educate pediatricians on firearm safety as part of our long-term goal to decrease morbidity and mortality related to firearms. So like Dr. Denny mentioned, I think, it's helpful to talk with our families about all the different types of things that can result in lethal means. We're focusing today on firearm safety specifically because that one has been reported as one of the more difficult conversations for providers to initiate with patients. And this will be sort of a simulation interactive experience. So also remember that simulation is low stakes. This is all about practice. So I hope everyone feels like this is a safe space to practice some of the language we might use when talking with families. So today we're going to focus on two sets of skills. We're going to focus on what we're calling our reach skills, which are specific communication strategies that we can use to introduce the topic of firearm safety and provide some basics around safe storage. And then we're also going to talk about motivational interviewing skills. I think we are all aware of those skills. Those are skills that help build rapport with families and help with collaborative decision making, which can be really helpful when we're talking with families about lethal means or firearms. So let's start with a couple of skills. So the first skill, and I will say that these skills were based on reviewing recommendations from national groups in pediatrics, such as the Ohio AAP, surgical groups as well, just trying to condense some of those key skills that might be helpful to talk with families about firearms. So the first step is really this contextual announcement. And this is basically the whole idea, like Dr. Denny had mentioned, of introducing the topic of firearm safety within the context of safety and anticipatory guidance that we already do with families. So for instance, what this might look like is you're talking to a patient named Alex about, typical safety guidance. You might say, I'm glad to hear that Alex is using an age-appropriate car seat. That's great. Also, as part of my safety counseling for all patients, I also like to talk about household firearms because we know that those can pose a safety risk to our children as well. So that helps to kind of put the conversation around firearms within the scope of practice for pediatricians. And the examples we're providing are just kind of like examples of words you could use, but I think part of the key to this is, being authentic. So figuring out what is the language, what are the words that feel right to you when you're introducing this topic to families. So after providing some context related to the discussion around firearm safety, we have found that it can be helpful to do a little bit of presumptive teaching. So before asking families about their storage practices, maybe just provide some brief insights related to what safe storage actually looks like. So what that might look like as an example is saying something, like research or, what we've learned over time is that the safest way to store a firearm is making sure that it's locked, that it's unloaded, and the ammunition is stored separately from the firearm itself. So with that information in hand, families might feel more equipped to respond to a screening question. So an example screening question might be, for firearms in your home or maybe other homes where Alex may visit, do you know how they're stored? Are they stored locked and unloaded? So a couple keys about this question. One is, I think we know that there's a high prevalence of firearms in homes. So I think we can be presumptive in our language in assuming that children are spending probably some time in a home where there is a firearm. However, that might not be their individual home. So sometimes including that statement or other homes that Alex may visit may take some of the burden off of a parent having to disclose personal ownership of a firearm, but allowing them to still get meaningful information. And also you'll see the focus here is not on owning a gun or not owning a gun. So Dr. March, a lot of her work has been working with community focus groups to understand their preferences for communication. And one of their real takeaways from that is focusing and screening not for gun ownership, but screening for storage strategies. So we're not asking, do you own a gun? Do you have a gun? We're asking for firearms that may be in your home or other homes where Alex spends time. Do you know how they're stored? Because that's really what it's all about, is the storage practices. Okay, so just to review, we talked about a few skills we could use. Introducing the topic of firearm safety, doing a little bit of presumptive teaching around those safe storage practices, and then asking about storage practices that are being implemented in the household. So with that, I was hoping that we could do some practice. For our first couple of cases, we're going to actually focus on young children during routine well childcare. I know the focus of this group is for kids, I think 12 and above. So our last case is going to be applying those skills in the setting of an adolescent visit. So let me just describe briefly how this is going to work. So you will see on your screen, here we go, virtual clinic space. So we have our parent and our patient here. So what I'm going to do is just give you a little bit of background around this case. And then we're going to practice the skills that we just discussed. So introducing the topic of firearm safety and talking with mom a little bit about it. So with that, this does require a volunteer to give this a go. Again, this is simulation, it's a safe space. So anybody want to give our first case a try?
I'll give it a try. This is Brenda in Lakewood.
Awesome. Thank you so much, Brenda. All right, let me give you a little background on this case. Got the right one pulled up. Yep. So you are going to be seeing a previously healthy 5-year-old child named Alex, who's accompanied by her mother named Phyllis for her annual visit. As part of the social history, you learn that the patient lives at home with their mom and a 2-year-old sibling. You reviewed everything with Phyllis and are now ready to discuss safety and anticipatory guidance. You start with car restraints, and then you turn your focus towards screening for access to guns in the home. So whenever you're ready, you can take it from there.
So I'd like to talk a little bit about firearm safety, if you don't mind. Do you know if Alex, if there's any guns that he might be exposed to, such as at home or at any of his friends' homes?
That's not an issue for us. We don't have any guns in our home.
Okay, well, if you find out that Alex is going to anyone's home that do have guns, it's a good idea to make sure that they're stored locked and unloaded.
I will check with family who watch Alex to see if they have any guns in their homes.
Thank you.
All right, great. So pretty straightforward task here, right? Introducing the topic of firearm safety, but I think it can be one of the biggest barriers to actually providing families with information. So I thought you did a nice job there. So let's take a minute to just kind of debrief as a large group. So I'm curious what strategies people noticed that, it was Brenda, is that correct?
Yes,
What strategies maybe Brenda used when talking with the family?
She didn't focus on ownership at all of the guns. That was really good.
Yep, so definitely that focus on safe storage, which is great.
I also appreciated she was talking about not just within their home, but other places where Alex might spend time.
Yeah, totally agree. So I think there's 2 ways to do that. One way would be kind of introducing that up front when you're asking the screening question. But I think the other way is, if the family says, oh, it's like in this case, it's not really an issue for us. We don't have any guns in our home. I think it's a great way to still give them information around safe storage by saying, like, I know Alex is, probably visiting other homes as well. So, one of the things we know is that there are lots of homes that have firearms in them, right? So just checking with friends or family about firearm storage and how they're sort of storing their firearms would be terrific to help keep Alex as safe as possible. And then you could provide that information around safety just like you did. That was great. Any other thoughts? Any other things people might have done differently in that case? All right, great. Well, let's keep going. Because I know that one was pretty straightforward. So things will get a little bit more interesting in our next case. So let me pull this back up. So I think one of the other big barriers, and this was certainly a barrier for me prior to doing this work, was really having any sort of like knowledge or awareness of storage devices or strategies, so that when families perhaps disclosed that there weren't safe storage practices happening in the household, I didn't feel like I had great advice to give them. So let's kind of review some of that. So I think we all are mostly familiar with this, that kind of ideally firearms, if they are located in the house, would be stored unloaded, locked, and with the ammunition separately. So let's talk about some of those locking devices specifically. So the first lock I want to talk about is something called a cable lock. So it looks a bit like a bike lock. That's usually how I describe it to families. It goes through the magazine well of the gun and prevents the firearm from being both loaded, which is kind of nice from a safety advantage. So in order to use this, this storage device, the firearm cannot be loaded. So advantage from a safety device, but we'll talk about how that might not be viewed as an advantage by all families. So the good news is it tends to be affordable and accessible. So they're often under $10. Again, the firearm has to be unloaded in order to use this. Of course, they could be cut with wire or bolt cutters, but as Dr. Denny was saying, when we're thinking about ease of access, right, with adolescents who are making a decision within 15 minutes to an hour regarding potentially lethal action, this would obviously be a barrier, even though there's potential to overcome it. The nice thing is these are widely available, so you can see them at a lot of retailers such as Amazon, Home Depot, Walmart, Dick's Sporting Goods, and Lowe's. So another common storage device is going to be something called a trigger lock. This actually goes through the trigger guard behind the trigger, which prevents the trigger from being pulled. So this can be unlocked with a couple of different devices, like a push button keypad, a combination lock, or a key. It's fairly inexpensive. These tend to be under $15. You can use them on most types of firearms, including long guns, which could be an advantage. Oftentimes they're included with the purchase of a firearm, so a family might already have access to this specific storage device. Just as a caveat, this blocks the trigger, but the use of it does not necessitate that the firearm be unloaded. So something to keep in mind when you're counseling families, because certainly if this firearm was loaded, even with the trigger lock in place, if that becomes disabled, then you could have an unintentional firing of the gun. This is available widely as well at all those same retailers we discussed. So another common storage device is going to be a lockbox. Lockboxes can be locked in a variety of different ways. So they might use like a digital keypad, biometric sensors, lock and key. They're compact and small, so often families can store them discreetly in the home. There's a wide range in terms of cost, usually somewhere between $25 and $100. If biometric sensor type lock boxes are going to be closer to the upper end of that range. Again, one disadvantage maybe from a safety standpoint is that it doesn't necessitate that the firearm be unloaded in order to use this. And this is widely available through all those same retailers as well. Finally, firearm safe is the last device today we are going to cover. They vary in size. They're typically beneficial for households where there are multiple guns, and we know that many households have multiple guns, and it does allow storage of long guns as well. Again, doesn't necessitate that the firearm be unloaded. So again, perhaps a negative from a safety standpoint when we think about comparison to the cable lock. It of course can be difficult to store this discreetly, so household members will often be aware where this firearm safe is located. I think one of the biggest disadvantages for at least the families I see in my clinical setting is expense. So these can be under $500, but can be as expensive as $2,500 based on the level of security. So these are available through those typical retailers as well. So just kind of quick overview, cable lock, it's very affordable, accessible, the added safety advantage that the firearm has to be unloaded in order to use it. Trigger lock, often accessible too because it comes with the purchase of a firearm and can be quite affordable. Lock boxes, I feel like, are often a preferred strategy for safe storage. They're compact, and of course there's firearm safes. So one caveat to all this is thinking about the concept of harm reduction. So I think ideally the safest home is a home without a firearm, right? The next, if a firearm is present, then having that firearm stored, locked, unloaded with the ammunition stored separately would be the next safest environment, right? But for some families, it might be really critical that that firearm be loaded, right? So if that is something that is identified as a critical thing for the family, even though all these devices can be opened very quickly to access the gun, and what you might want to think about in your counseling is what is going to be the safest way to store a loaded firearm in a household, right? We talked about with trigger locks, those can be disengaged. So with a loaded firearm, you might want to think about something more like a lockbox than a trigger lock because of that possibility. And certainly a cable lock might not work with the family because, again, it does require that the firearm not be loaded in order to use it properly. Okay, so covered lots of information there. So we'll get to practice a little bit of that in our next case. And just quickly, I wanted to review some motivational interviewing skills that could have some relevance or kind of help you as you're having this conversation. So the first skill is going to be asking permission. This is exactly what it sounds like. It's asking permission to provide information. So if a family reports to you in terms of their storage strategies, Alex's father does have a gun in the household. We keep it unloaded, but we don't use any sort of locking device. You might ask, is it okay if I share with you some ways that we could store the gun to keep Alex as safe as possible? So I think it's important in this content area to emphasize a family's sense of autonomy and ability to have choice. So where I tend to include that is if I review some of the strategies, we talk briefly about cable locks, trigger locks, lock boxes, I might say. We've talked about a few ways that we could store the gun as safe as possible. Which of those strategies do you think would work best for your family? Finally, affirmative language. This helps to emphasize a family's strengths, skills, and abilities. So this would be saying things like, I really appreciate you having this conversation with me, and I, as always, appreciate how dedicated you are to keeping Alex safe. Okay, so we covered a lot of information there. So let's do some practice. Just like before, I'll share a virtual space, and then we'll be able to practice introducing this topic like we did in the last case, but also maybe providing some information to a family who might not be utilizing safe storage strategies within their household. So any volunteers who wants to give our next case a go?
I'm gonna need Dr. Robbins.
Oh, I heard a nomination, I think.
I can do it if they don't want to.
All right, Sarah, that would be great. All right, let me pull your characters up here. I think I got it. All right, are you seeing the clinic space, Sarah?
Yes.
Okay, excellent. All right, so let me tell you a little bit about this case. So you're going to be seeing a previously healthy 5-year-old child named Alex, who's accompanied by his father named Phil for his annual visit. As part of the social history, you learn that the patient lives at home with their 2 dads and a 2-year-old sibling. You reviewed everything with Phil, and you're now ready to discuss safety and anticipatory guidance. You start with car restraints and then turn your focus towards screening for access to guns in the home. So whenever you're ready, you can go from there.
All right. Well, great. I see that he has an age-appropriate car seat, a good smoke detector. I also want to discuss safety with firearms. For any firearms that might be in your home, are they stored locked and unloaded, or any homes that he might visit?
Yes, but we keep it loaded. I bought it to make sure our house was safe in the event of a break-in. We had one of those a few years back, and I felt helpless. It was scary, and I never want to feel that way again. I keep it in the nightstand, so it is easily accessible. But we feel confident Alex doesn't know where the gun is.
My goodness, I am so sorry that happened to you. That sounds horrible. Is it okay if I share some more information about some options to keep him safe?
Sure.
Great. Well, research shows that it's very good to lock firearms, just in the risk that he could get injured. It's happened to other kids. There are lots of options like lock boxes, which you can store the gun loaded, although we prefer it's unloaded, but we want you to feel safe. There are trigger locks, cable locks where you could keep it loaded as well. There's lots of options. Do you have any questions about some of those things?
Do you think we really need one of those?
I do. I would recommend it. We even have lock boxes in our office, if you would like to use one.
I think the lockbox could work.
Great. We'll get that to you today, and make sure to talk to all of your family members as well. I know you want to keep him safe just as we do. And do you have any other questions?
Honestly, it makes a lot of sense. We will look into getting something to keep the gun safe this weekend.
Great.
All right, great job, Sarah. We'll give you a round of applause here. All right, so for the whole group, curious what people thought. What were some of the strategies, things that they saw that Sarah did that they thought worked well?
Hi, it's Laura Mason. I really liked the way she worked with him with the incident that happened, and that he wanted safety with having the loaded gun, and gently went into the subject of keeping it locked and safer. And I thought it was a really good strategy.
Yeah, I agree. I liked you asked permission, right? First you responded to this event that occurred, right, and recognized how traumatic, how challenging, how stressful that must have been for the family. And then asked permission. And when you did so, you sort of aligned it with keeping Alex safe, right? Because that's like, I think, a shared value you're going to have with the parent is keeping Alex as safe as possible. So I thought that was great. What else?
I felt like after she provided the education, she kind of then did sort of a readiness for change, like checking in, like, hey, now that we've kind of talked about that, do any of those seem like, something that you'd be interested in, so that then she could assess that readiness and then make it actionable with, hey, we actually have those lock boxes right here. You can take one today. So I thought she just like followed that motivational interviewing process so perfectly throughout the whole conversation. And I agree, the empathy towards how scary that must have been, and then kind of working within that construct was really well done.
Totally agreed. Yeah, I think discussing the storage strategies. I like the way you kind of want to do it quick and succinctly, without giving too many details, right? So I like the way you did it. One thing I might do is, because it's really hard, that balance in harm reduction, right? Because I ideally, and you said this, like ideally the firearm would not be loaded, right? So I think it's good to provide it, like, research, or what we've learned over time is the safest way is having the firearm like loaded or unloaded, locked, and it's stored separately from the ammunition. So the types of devices we think about with storing, and you could talk about them briefly, like the cable lock looks like a bike lock. It goes through the gun. You can't load the gun in that case. And then you could talk about, the trigger lock and the lock box, and say that, ideally the gun would also be unloaded, but if the having the weapon loaded is really critical for your family, I think the lockbox might be the one that works best for you. But what sounds good to you? Like, what do you feel is aligning with what your family really needs? Yeah, I think that can be sort of a nice way to make sure they're getting that, here's the ideal state, but like, let's think about harm reduction. What's going to be the safest for your family? The other thing I talk about sometimes, when Dad had mentioned like something like, but we know Alex can't get to it, right? Like, we know Alex is 5. Like, I think sometimes being like, not debating with the parents that like Alex isn't gonna find it, but we know he probably knows where the gun is, and then we know from the literature that there's a lot of kids who have handled a household gun without their parents' knowledge. So sometimes I kind of just align that with kids being curious, right? Like, instead of saying that Alex knows where the gun is and being like, the data shows he probably knows, just saying like, Alex is curious, like he's, exploring his world, his environment. I'm concerned that like his curiosity, he might come across that gun, right? And so how do we store it as safe as possible so that if Alex were to come across it, that he wouldn't be at risk of, causing some sort of injury to himself or others. So that's something else I sometimes bring up with families if there's like, the thought that, he doesn't know where it is. He probably knows where it is, but let's kind of not debate that. Let's align it with our goal, which is keeping Alex as safe as possible. So that was great. Any other thoughts that people had on that case? All right, let me jump back to my slides here. Are we doing on time? All right, we're good. Okay, so what I want to do next is kind of use all these skills that we just practiced in the context of young childcare and think about the application to adolescents. And everything we talked about today, again, we're talking about in the context of firearms, but I think we want to think about all the other, things that can result in a lethal means, like medications, for instance. And so we know that access really matters, right? So When we think about our adolescents, simply having access to a gun increases the risk of firearm-related suicide 3 times. And when we look across the population and think about what's causing the most firearm-related injuries, in our younger kids that we just discussed, we think a lot about those unintentional injuries from an accidental firing. But in those kids at adolescent age, we're thinking about suicides and homicides, and across the population, suicides account for 60% of all firearm-related deaths. So what I'd like to do for our last case is just practice these same skills, but think about their application to an adolescent. All right, so if we can get a volunteer for this case, this is your last opportunity to practice today. So take advantage of it. All right. Any volunteers for this one? Remember, simulation is fun. This is great practice. Sarah and Brenda probably had a wonderful time doing this.
Hi, it's Rosemary Robbins. I'll try.
Awesome. Thank you so much, Rosemary. Really appreciate it. And that's what it's all about. It's all about trying. So I appreciate that. No one is an expert on this. I feel like every time I do a session, I'm like learning from how other people are asking questions, and then I'm changing the way I do it. So, all right, so I'll tell you a little bit about this case. So this is going to be a previously healthy 16-year-old adolescent. His name is Alex. He's accompanied by his mother named Phyllis for an annual visit. Alex lives at home with his mom and dad. His PHQ-9 score today, which was obtained at intake, was a 10, indicating moderate depression. You do a confidential interview with Alex, and he reports feeling mostly in the middle. He denies any suicidal or homicidal ideation. You ask Alex about access to lethal means, including firearms in the home, and there is one firearm. So Alex gives you permission to talk with his mom about his mood and the firearm in the home. So you discuss Alex's mood with mom and make the plan to start therapy through school. And next, you want to talk with mom more about the firearm in the house. So whenever you're ready, you can take it from there.
Okay, well, it's nice to meet with you and Alex today. I'd like to talk to you. Alex shared with me that you have a firearm in the home, and I'm wondering how you manage the firearm at home, how you store it. Can you
Yes,
share that with
but we
me?
keep it unlocked. I grew up with guns in the home. It's what I know. I am familiar with them and appreciate having the freedom to own one if I choose. But we make sure Alex can't get to it.
Okay, very good. And how do you make sure Alex cannot get to the gun? How do you store it?
I'm not sure.
Okay, very good. Well, it is recommended that we lock the firearm for safety's sake. We're talking about safety today, and that's one of the things we talk about in well care. And there are different ways to lock the gun. Are you aware of any of the ways that you can do that?
I don't know.
Okay, there's certain trigger locks and there's lock boxes you can get. But it is very important that if we have a teenager in the home, that we lock the firearm. Would you be agreeable to doing that?
I'm not entirely sure. Do you think we really need one of those?
Well, I do, because the teenage brain is not fully developed yet, and sometimes they have some you know problems, and then they think about what can they do, and sometimes they'll impulsively reach for things that they wish they hadn't. So I think it's better to lock up the gun. It's recommended. And there are intentional and unintentional injuries, across the nation. They've done research on teenagers, and they're a higher risk. So I do recommend that you lock up the firearm.
You're right. I want to keep Alex as safe as possible. I think the cable lock could work. Where do you get a cable lock?
Well, you could go, are you familiar with Amazon?
Yes.
Okay, well, then I would recommend going on Amazon to look for the gun lockbox. We also might be able to facilitate you getting a lockbox as well. And I can give you further information on that. Would you be okay with that?
Thank you for sharing. This was very helpful.
Thank you for listening, and thank you.
We will look into getting something to keep the gun safe this weekend. You know, Alex stays with my sister a lot, so I am going to talk to her about this too.
Excellent. Excellent. I'm so glad that you're going to do that, because yes, it should be checked out in other places where Alex visits as well. Thank you.
Yay, great job. Wonderful. So let's debrief a little bit on that one. So what were some of the things, it was Rosemary, is that correct?
Right.
That Rosemary did that people liked?
I appreciated specifically three things. One, not engaging in a debate about the right to have guns and just moving on, like acknowledging, moving on. The other thing was when the mom asked, "Do you really think?" She was very direct and clear in her response. Yes, and this is why. And then I also really liked the use of intentional and unintentional injury, right? Because that definitely is part of this. So that was well done.
Yeah, completely agreed. Yeah, I loved all the affirmative language throughout. That was like, thank you. I really appreciate you thinking about this and keeping Alex safe, and really emphasizing that shared value around, this is important. Yeah, I do think this would be helpful because we want to keep Alex as safe as possible. So that was great. Anything else that anyone wanted to comment on?
I would just say I liked how Dr. Robbins kind of stuck with it, because Phyllis sometimes was being a little, oh, I don't know about that. And you just kept a very nice, polite tone and just kind of kept with the conversation. And I really liked how you did that. Phyllis was not easy. Let's put it that way.
Yeah, no, this is a challenging case. But yeah, I completely agree with like Dr. Denny's comment around not debating around gun ownership or the experience, and then not assuming that there's advanced knowledge related to storage practices, kind of asking, kind of like, oh, are you familiar with like storage devices, but doing so in a non-judgmental sort of manner and keeping that tone level, sort of normalizing it all. I think that's great. I think where we get into trouble is when people sort of put guns and firearms on that pedestal, right? They're like, okay, we're going to talk about guns. And then it's like, but you just kind of normalized it, made it part of your guidance. So I think that was really great. So well done. And again, this case, the patient had depression, right? So clearly, we want to make sure and assess lethal means in this case. But I think taking that opportunity with all of our adolescents when we're having that confidential interview, and assessing for access to lethal means can be really important, since we know that they can be impulsive. And I like how you brought that up. Like, teenagers are impulsive, right? And so they can make split decisions, and we want to make sure that, if any barriers can be in place to prevent a bad outcome, we want to have those in place. Let me jump back to my slides here.
And Dr. Real, I just wanted to mention, before I don't know if you want to address this kind of before we move on, but we had a question that came up in the chat about a particular scenario. So I don't know if you and Dr. Denny maybe wanted to give some suggestions on this. So how do you address a parent who is a policeman who needs to have his firearm loaded and ready to go? According to him, he keeps it at the top of the fridge in the kitchen.
I can share a couple things and thoughts on that. One is, we in our network had a 3-year-old whose dad kept the gun loaded on top of the refrigerator, and that child woke up one morning and climbed up on the counter to get cereal and found the gun, and unfortunately it had a fatal outcome. The other thing is I have a lot of friends who are policemen, and I don't know the policy, but what I know from what they've told me is that they're required to keep their gun locked unless it is physically on their person. So if it's in their car, they need to have a lock in the car. If they're keeping it in their house, it's supposed to be locked. So unless it is physically on their body, then it's supposed to be locked. I don't know, Joe, if you have other input or thoughts or experience with that.
The other thing I've found is people that have advanced training in firearms, because it's job related, recognize how quickly a storage device can be removed during an emergency situation. So I have found families who, have guns as part of their job or required to have them. They get like how quick you can get a unloaded gun out of a lockbox and loaded, or are removing a cable lock or trigger lock. So I think that barrier is less, the unlocked barrier is less concerning, I found, for individuals that have more of that advanced experience and training. And there are certainly videos online. The New England Journal of Medicine just released a video around this, kind of like explaining storage devices, but also demonstrating how quickly a device can be removed in the setting of an emergency. Because we know that safety is why a lot of families have firearms, but we know having an unlocked firearm in a household actually doesn't make the household safer and makes it more likely to have a firearm related injury. It's a good question. Yes, and thank you to everyone who participated in our virtual cases today. I so appreciate it. It's always a much more enjoyable session when it's not me trying to go back and forth with the avatars while I run them at the same time. This is still sort of a new curriculum for us, so I put a QR code up here on the screen. So if you have any feedback for us on ways that we could improve this, please let us know. But we are happy to be here. So thank you again to Dr. Denny and the Ohio AP.
Yes, thank you all so much again for providing this. And please remember, as you are having conversations, things are going to come up, situations are going to come up. We're always here to hear your questions about that and try to be helpful and responsive to those. So just a couple of final reminders that I have, and that is, please remember to keep entering your data. So again, we know, sometimes things are going to get missed, but get in that habit of, for every one of those preventative visits that you have, make sure that you are entering that after your appointments. Also, remember that your workflow is due at the middle of the month. So again, be working on that and email that to me when you are finished. Remember that I'll send those invites for our office hours, and that'll be a great time to ask any workflow questions or other questions that come up. So be on the lookout for those. Those were the final reminders that I had. So if anyone has any additional questions or comments about today's topic or anything that's come up related to the program, please feel free to ask now. Some of you I know have been doing an amazing job giving out lock boxes. You've already given out the first batch that we sent out. So I have some more going out on the way to you. So a reminder to just keep me up to date too as your stock gets low, or if you get low on resources. Any other comments or questions before we sign off today?
I do have a question. This is Rosemary. And maybe maybe you've gone over this in the, we're going to be looking at the prior two sessions, but I was surprised that I always say, you know, is the gun locked, is the gun and unloaded, but the gun can be loaded and locked. Is that correct?
So ideally the gun, they're kind of two separate mechanisms. So it's like loaded and locked are two different things. There are certain devices that require the firearm to be unlocked, which is like, or to be unloaded, which is with a cable lock. For a lockbox, the recommendation would still be that it be unloaded, ideally. So ideally, the firearm would be locked in a cable locks, or in a cable, or the firearm would be locked in a lockbox, unloaded. That's ideally what would occur. And so, and then if you want the ammunition separately, there would be a separate lockbox for that other ammunition. So, however, in some instances, because families often have firearms for safety, families might feel that having the weapon loaded is really critical. So it's not the recommendation, but that it be loaded in a lockbox. But it's something that families can do, and probably the safest way to store a loaded firearm in a household. At least that's my sort of thoughts. Dr. Denny, anything you'd add to that?
Yeah, it's really along that harm reduction continuum, right? Like, yes, ideally there's no gun. If there is a gun, we'd love it to be stored, locked with the ammunition separately. But if, you know, if they, again, want it for safety and it's loaded, then at least making sure that it's locked up.
Okay, okay. And with the trigger lock, it can be loaded or unloaded? I mean, ideally unloaded.
Ideally,
Right.
but using the trigger lock, you don't have to unload the gun. But the issue
Okay.
with the trigger locks is they can become disabled sometimes, and then they can lead to an accidental firing. But ideally, if you're using a trigger lock, that the gun would also be unloaded.
Okay, thanks so much.
Yeah, no problem. Thank you. These are all things I'm learning. So please, people, feel free to correct me as well.
All right. Well, thank you all again, and I will have a follow-up email out to you with the slides from today and the recording as well. So thanks again for joining us, and have a great rest of your Thursday.